So, knock knock.
Come in.
So I'm gonna close the door for privacy, wash my hands. Hi, my name is Karina. I'll be your nurse today. I'm here to do a head to toe. Is that okay?
Yes.
Okay, can you verify your name and date of birth for me?
Wallace Peterson, 6645.
Okay, and your MR number is 7214732. Mr. Wallace, are you allergic to anything?
Not that I know of.
Okay, and I don't see an allergy band. I'm gonna go ahead and put my gloves on. I'm gonna get a quick set of vitals on you. Your blood pressure is on the top.
Oh, I'm supposed to tell you that?
Mm-hmm.
127/89.
Okay, and your temperature is
101.9.
okay, and your heart rate
93.
okay, and your respirations are 28, and your O2 is 90% on room air. And I have orders to administer oxygen and keep your O2 above 92%. So I'm going to go ahead and administer 2 liters of oxygen, and I'm going to elevate the head of the bed. How does that feel?
Good.
Okay, all right. So, Mr. Wallace, are you in any pain right now?
A little bit.
Okay, and on a scale of 1 to 10, how would you rate your pain?
Probably a 3.
Okay, and where's your pain located?
My lungs.
Okay, and what makes your pain better?
Not coughing.
What makes your pain worse?
Coughing.
Okay, and what is the quality of your pain? Is it achy?
Yes.
Okay, it's achy. And does your pain radiate anywhere?
No.
Okay, and when did your pain start? 2 days ago? Okay. Alright, so let me see. Do you know where you are right now?
Hospital.
Okay, and do you know what today's date is?
It's the 21st.
Okay, and do you know why you're here?
Yes.
Trouble breathing. Okay. Okay, alright, so I'm gonna start my head to toe assessment if that's okay with you.
Mm-hmm.
I'm gonna inspect your eyes, and your pupils are about a 5. I'm gonna have you focus on an object behind me, and I'm gonna check for constriction. I'm gonna just shine this light on your eyes. Okay, your pupils constricted. I'm gonna have you follow my finger. Alright, so perla is present. Pupils are equal, round, and reactive to light and accommodation. I'm gonna have you say ah for me. And your mucous membranes are pink, moist, and intact. There's no lesions or any sores. Alright, Mr. Wallace, I'm gonna unbutton your gown so I can listen to your heart and to your lungs. So I'm gonna do that. Alright, I'm gonna inspect the chest, and the chest is symmetrical. Color is appropriate for ethnicity, and it's warm to the touch. I'm going to check skin turgor, and it's non-tinting. I'm also going to listen to 8 positions in the front and 10 positions in the back. I'm going to have you take a deep breath. Okay, I'm going to listen to your heart sounds. I'm going to start on the right second intercostal space, the aortic. S1 is 2 heard. Then the left second intercostal space, pulmonic. S1 is 2 heard. The third intercostal space on the left, Erb's point. S1 is 2 heard. Fourth intercostal space on the left, tricuspid. S1 is 2 heard. Then the fifth intercostal space, the mitral valve, midclavicular line. S1 is 2 heard. I'm going to listen with the bell for a couple seconds. And there's no murmurs or any extra heart sounds. Now I'm going to listen here for 1 full minute. cervical pulse was 98. Mr. Wallace, have you had a cough recently?
Yes.
Okay, and is it productive or non-productive?
Productive.
Okay, and what color is it?
Yellow.
Okay, and is it thick or thin?
Thick.
Okay, and what color was it? Oh, you said yellow, sorry. Well, if I give you a cup, about how much would it be?
15 milliliters.
Okay, all right. I'm gonna also check for the rate and rhythm of your respirations. And it's irregular, shallow, and labored. Okay, all right. So, Mr. Wallace, cough and deep breathing exercises will help get rid of that mucus. It also help open up your lungs. I'm gonna check your brachial pulses. And they're 2+ bilaterally. I'm gonna check your radial pulses. And they're 2+ bilaterally. Mr. Wallace, I'm gonna have you push up on my hands, then push down. I'm gonna have you grip my finger. And I'm gonna check capillary refill, and that is less than 3 seconds. Your upper extremity strength is +5. I'm gonna inspect your IV site, and it's clean, dry, and intact. There's no swelling or any redness or signs of infiltration. It's dated for today. Okay, all right, so now I am going to inspect your abdomen. So I'm gonna lift your shirt. Your abdomen is round. There's no masses present. Color is appropriate for ethnicity. I'm gonna listen to your bowel sounds. I'm gonna start in the right lower quadrant, then the right upper quadrant, the left upper quadrant, and the left lower quadrant. And bowel sounds are active. I'm gonna palpate your abdomen. Let me know if you feel any pain or tenderness, okay? Feel any pain or tenderness down here?
No.
Okay, and what about up here?
No.
And over here?
No.
And what about down here?
Nope.
Alright, so there's no pain or tenderness upon palpation. Mr. Wallace, what'd you have for breakfast? Oatmeal? Okay, and a cup of coffee. Okay, when was the last time you had a bowel movement?
Today.
Okay, what color was it?
Brown.
Okay, and did it have a smell to it?
Yes.
Okay, and what was the consistency of your stool? Was it hard, soft?
Hard.
Okay, and what was the amount? Was it small, medium, or large?
Small.
Small, okay. All right, so I'm gonna inspect your genitals. I'm just gonna expose you a little bit, and I'm gonna touch it, and there's no sores or any lesions. There's no swelling or abnormal discharge or any abnormalities. Before I cover you up, I'm gonna take my gloves off. I'm gonna wash my hands, and I'm gonna put new gloves on. All right, Mr. Wallace, when was the last time you urinated?
Earlier.
Okay, what color was it?
Yellow.
Okay, and did it have a smell to it?
No.
And was it clear or cloudy?
Clear.
Okay, and if I give you a urinal, about how much was it?
150 milliliters.
150, okay, all right. Did you have any pain with it?
No.
And what about urgency?
Yes.
And did you have any change in frequency?
No.
Okay, all right. So now I'm gonna move down to the lower extremities. I'm gonna inspect first, and their color is appropriate for ethnicity. It's warm to touch. Your feet are moist. There's no skin breakdown. I'm gonna check for edema, and there's no edema present. I'm gonna check your dorsalis pulse, and it's 2+ bilaterally. I'm gonna check your posterior tibial pulse, and that's 2+ bilaterally. I'm gonna check your capillary refill, and it's less than 3 seconds. I'm gonna have you push down on my hands, then I'm gonna have you push up. All right, great. I'm gonna take these off before I cover you back up and wash my hands. Mr. Wallace, I just want to encourage you to make sure that you're turning at least every 2 hours to prevent skin breakdown. I also want to encourage you to weigh yourself every day around the same time, preferably in the mornings, wearing similar clothing, and also report any weight gain of 2 pounds or more in a day or 5 pounds or more in a week. You also want to report any shortness of breath, wheezes, or edema. And let me see. Also, due to you having COPD, I recommend for you to have small, frequent meals, and also follow a low sodium diet, because low sodium makes your body retain fluid, which makes your heart work faster and makes breathing a little bit more difficult for you. So if you reduce your sodium intake, you will be able to reduce like swelling and stuff like that. All right, could you give me a little bit of feedback on that
Yes.
with the sodium?
I shouldn't have too much sodium.
Yes. And when should you weigh yourself?
Every day?
Yes.
At the same time?
Yep. And you're gonna make sure that you report a weight gain of 3 pounds or 2 pounds or more in a day.
And 5 in a week.
Yes, exactly. And also, I am going to do a little bit of teaching on this incentive spirometer. This will help improve your lung function. It'll help open up your lungs, and it'll help get rid of the mucus. It also helps lower your lung risk for lung infection like pneumonia. And the way you use it, you're going to want to sit up as far as you can. You're going to hold it upright. You're going to cover the mouthpiece with your lips, and you're going to exhale and then inhale, and you're going to hold it for about 5 seconds, then you're going to exhale. And you're going to want to repeat this at least 10 times an hour or every commercial break. I'm going to have you try it. Okay, and you got 750 mLs, which is decent. Okay, so when are you going to use your incentive spirometer?
Like every commercial break.
Yes, or 10 times an hour. And what is it for? Like, what are the benefits of it? It improves your lung functions, and it gets rid of the mucus, and it lowers the risk for infection. Yes. Okay. All right. Great. Okay. All right, Mr. Wallace. Before I go, I'm gonna make sure that the bed is in the lowest position. The rails are up. Your call light's within reach. Is there anything else I can do for you?
No, thank you.
Okay, all right, so I'm gonna open the curtain or open the door and wash my hands. Let me turn it off.